Hello, I'm Dr. Damien Welburn. I'm one of the doctors at Raymond Terrace Family Practice. As you know by now, we're planning to operate a community respiratory clinic out of our facility at Raymond Terrace. This is just a short introduction to explain to you what happens at our clinic. So patients that have been assessed as needing an assessment for COVID-19 will be invited to come to the clinic by appointment. Appointments will be allocated at designated times and patients should arrive by car where possible. We've arranged to have some parking immediately outside our facility, and when patients' appointment time has arrived, they come to the parking spot and we've got a room where we can see them from and communicate with them. The flow from there will be that we'll phone the patient and collect their data for the demographics and admin side of things. Then the doctor will talk to the patient and find out how they're travelling, what their symptoms have been, check them against the criteria for an assessment. After all of that is done and the room is ready for the patient to come in, we'll invite the patient to enter the facility. They come in by a dedicated rear entrance to the practice, which is separate from our main entrance, located off Swan Street. The rear entrance keeps the potential COVID patients separate from the rest of the community to keep them safe. And we've got some designated rooms which we've made safe for the patients with negative pressure and isolation, so that they can be assured that they're not coming into a place that's riddled with coronavirus as well. They come to the door, they'll be greeted at the door by a person wearing a mask. That person will ask them to hold out their hands and put some hand sanitizer on their hands to clean their hands before they come in. They'll be given a mask to wear whilst they're inside the facility. After that, they'll walk through into the isolation room, and in there the doctor will make a physical assessment of the patient. That will include, as a minimum, checking their temperature, their oxygen saturation, their pulse rate, and if necessary, further things like listening to their chest and blood pressure and other assessments that may be required. If the patient needs a sample collected for COVID-19 testing, that sample will be collected in that space, and information given to the patient about how to manage the results and what to do in the event of a positive or a negative result, and then the patient will leave the building. After the assessment is completed and the result comes back to the practice, the result will be communicated with the patient and also, where possible, with their regular doctor, so that their regular doctor can continue care from that point onwards.